name is Donna Malincrot, and I'm the ISMA Medicare Specialist. Because drugs can change each year, Medicare allows subscribers to change their Part D prescription drug plan. All Part D plans will cover basic generic low-cost medications, but they may only cover some non-preferred generic and brand name drugs. Part D plans are sold by private insurance companies, and changes occur each year. Some drugs are dropped, some drugs are added, and tier level assignments can change too. So it's important to verify that the drugs you're taking are available at the lowest premium and copay cost. Using the Medicare Plan Finder allows you to find and compare plans in your area, verify that your drugs are covered, and review estimated copays that you'll pay at the pharmacy. So let's go ahead and get started. First thing we'll want to do is log into Medicare.gov. And you can either do that through Google or any one of the browsers that you like to use. So once you get into Medicare.gov, we'll be on this page. And if it's after October 15th, then go ahead down to this little bar here and we'll click on Find Plans Now. The next page is automatically going to pop up, and it's going to start with Continue Without Logging In. This is the easiest way to get a drug plan recommendation. You're welcome to log in if you like, and the Medicare Plan Finder will keep a history of your drugs, but for our purposes today, we're just going to continue without logging in. Of course, we're looking for 2023 drug plans, and go ahead and put your zip code in this little bar. Under Plan Type, click on the down arrow and add Drug Plan Part D. Click on the blue Apply and Start. This next page, Help with Your Cost. Most of us are not going to be receiving either state or federal assistance to pay for drugs. So if that's the case, go ahead and click on I don't get help from any of these programs. And then we'll go ahead and click Next. Do you want to see drug costs when you compare plans? Yes, we do. Click Yes and Next. Okay, so now we are up to the page where it's time to start adding drugs. So if you want to pause the video, you're welcome to, and then you can make a list of your drugs. If you haven't done that already, be sure to include the strength and frequency of each drug when you start to type in your medication list. So for right now, I'm going to add in a few drugs so we get the idea of how this works. So the first drug I'm going to add is going to be Flomax. And you'll notice that as soon as I start typing in the FLO, words starting with those letters will automatically populate. So I have Flomax, and now I'm going to click on Add Drug. And let's go back and try that one more time. Oops. Here we go. Sometimes it takes a few minutes to get where you need to be. So this message is telling us that there's a generic drug that's available, and it's asking me if I want to switch to the generic or stick with Flomax. Well, certainly I'm going to stick to the generic because that'll save me money at the end of each month. So with Flomax, there's only one strength, so this one is pretty easy. It's 0.4 capsule. Let's assume I take one per day, and so that means each month I will need a refill of 30. And we're going to add that to our drug list. And then let's go on in and add another drug. Let's go ahead and add a brand name expensive drug. We'll add Tradjenta. And you can see I actually spelt the word wrong, but because of the drug plan finder that automatically populated it, corrected it. And so now I can type on that and here we are again. And Tradent is another drug that only has one strength. So we'll go ahead and click on that, add to my drug list. Let's add one more in here. So we'll add another drug. Let's say we can add a hard to spell word called hydrochlorothiazide. So because obviously I don't know gracefully how to spell that, we'll start off with hydro. It automatically populates. Here it is. And then we'll add that drug. We'll select a strength. Let's say I take 12.5. And then we're going to go ahead and add that to our drug list. Okay, so now we have 3 drugs on the drug list, and we'll assume that that's all that I take other than over-the-counter drugs, and we're going to go ahead and click on Done Adding Drugs. Now this next page is asking which pharmacy I like. Generally, when I do recommendations, I like to use CVS and Walgreens. And the reason for that is that a lot of the pharmaceutical companies will contract with one or the other for preferred pricing. So let's add both of those, and that'll give us a good idea of which pharmacy is going to be hopefully a little bit less expensive than the other. And let's assume here that I have one more pharmacy. We'll say Costco. Now, Costco is not within 1 mile of my home. So if I wanted to use Costco, I'd go up to this distance, 10 miles. I'd apply that. And I'm going to look down and, nope, it's still not here. So then I go up here and name a pharmacy, type it up, and in, find pharmacy. Here it is. We'll use this one on 86th Street. So now I have 3 pharmacies that I've listed for comparison reasons. Click Done. Yes, and now we're on the page with the recommended plans. So the Medicare Plan Finder automatically will populate the very first drug plan, WellCare Value Script, listed as being the lowest cost drug plan available that's going to cover your drugs at the lowest cost. Now, if you wanted to scroll down a little bit, we'll see that the yearly drug and premium cost for this plan is $1,226. If we go down to the next plan, which is Silver Script, the yearly drug and premium cost is $1,388. And then the next plan, WellCare Medicare, is $1,438. So clearly, if the lowest cost plan available is going to be with WellCare Value Script. Now, if this was after October 15th, there would be a little green bar here that you could use to enroll in the plan. But let's go ahead and look at some of these plan details. So the first thing it's telling us is that the monthly premium is $10.60. What Medicare likes to do is they like to take the premium out of a Social Security check. So for those of you that are collecting Social Security, you might notice that there's a deduction for a Medicare Part D premium. This is also noting that this plan has a $505 deductible. What that means is that subscribers that have drugs that are subject to the deductible, that means they have to pay the first $505 before the plan begins to pay its share. So certainly Tradent is going to put us in that $505 deductible range. But let's keep going down and see what else we can find. This is just basic information about pharmacies. So we see here that all 3 of the pharmacies are going to be preferred in network. So if I had to choose a pharmacy for my purposes today, I'm going to choose CVS. So I go up here to this little area and I'm going to change my pharmacies. I'm going to take Walgreens off just by clicking on that X, and I'm also going to take Costco off because I only want to look at pricing for CVS, which is within 1 mile of my home. I'm going to go ahead and click Done, and then I'm going to go back. So now this is telling me exactly what I will have to pay per year if I use CVS Pharmacy. So always look at these titles of these sections. Yearly drug costs by pharmacy. So that means Tradjenta at 5 milligram tablet is going to cost me $1,048 per year. Let's go scroll down and we can take a look at the month by month drug cost. And this is actually pretty interesting. So it's listed right here, and it does go January through December, but we're going to start off looking at January. So January is going to be a very high expensive month because I have to pay that whole deductible, which will be $505 and then a little bit more. So in January, to have all three of my drugs, I'll be paying $521. In February, it's going to drop down dramatically for a few reasons, and I'll pay $16 February through through August. September is kind of an interim period in between the coverage gap and the initial coverage period. So I'll pay $62. In October, November, and December, I'll pay $134. So what that $134 means that I'm paying 25% of the cost of my drugs. And at one time, the donut hole, as it used to be called, or the coverage gap, was up to 55%. And so pharmaceutical companies now chip in. And so we've gotten that down from 55% all the way down to 25%. The estimated drug cost during coverage phases. This is some pretty good information. So because I've decided I'm going to use CVS Pharmacy, I'm going to click right there. And this is going to tell me a couple of interesting things. One is going to be the retail cost. Hydrochlorothiazide, $2. Tamsulosin, $6. But Tradjenta is the high-cost drug at $530. The cost before deductible and the cost after the deductible is covered. So after the deductible comes in basically February through August. Cost in the coverage gap, this is where we'll pay 25%. So if we were to, if I had my calculator out, I'd probably do 134.63 times 4, and it would come out to 538.53. So remember, in the coverage gap, subscribers now pay 25% of the cost of their drugs. Let's go ahead and look at some more drug coverage. So these are the tier levels. You've probably heard that term, tier level assignments. The best tiers are the lower tiers. So tier 1 is preferred generic, tier 2 generic, tier 3 preferred brand. That might be a brand name drug that has been out there for a while and it's not quite as expensive as it once was. So they put that in it's a tier all for itself. Tier 4 is a non-preferred drug. So that might be a newer brand name drug. And you can see that's a pretty high cost drug at paying 47%. A specialty tier is 25%. And a new category just added in 2023 is select diabetic drugs at an $11 copay. So you're probably wondering, well, wait, why did the Tradjenta not fall into this category? Well, it did fall into the categories. We can see right here, the tier level assignment for Tradjenta is tier 6. But if we go all the way back up here, we're going to see that we entered into the coverage gap in October. So once someone enters into the coverage gap, the special pricing for tier level 6 goes away, and then it changes to 25% of the cost of the drug. But we did get to take advantage of it for several months. And the last 3 months, though, we entered into the donut hole or the coverage gap. So let's continue to go on down, see what else we can find here. This is a pretty important part. This will let you know if there are any restrictions on the drug. So there's nothing for hydrochlorothiazide or tamsulosin, but there are restrictions on Tradenta. And traditionally what that means, if there's quantity limits, that means that a 30-day script can only be filled and not a 90-day prescription. So if you have a 90-day prescription from your doctor, they'll only give you 30 days at a time. Step therapy, we all know what that is. There's no step therapy for any one of these drugs. These drug companies can and do require that a subscriber not start on a brand name drug until they've tried some of the generic lower cost drugs that are available. This is the drug list, so I'm verifying one more time. I just want to make sure that's all the drugs that I take. Part B drugs. So what this is saying is that Part D, the prescription drug plan, is not going to be paying for chemotherapy drugs. That will be covered under the medical portion of original Medicare known as Part B. And the reason for that is that any drugs that are actually given in a medical setting where you have to go into a doctor's office or clinic, that's covered under the medical part, Part B, and not D. Part D is only covered when you walk up to a pharmacy window and hand them a prescription and you walk away with the package. And we would never do that with chemotherapy drugs. So as we scroll down to the star ratings, we have 3 stars, and that's pretty good. 3 stars is a pretty good rating. I don't think I've ever seen a plan with 5 stars. I've seen a few with 4, but 3 is pretty average. So again, if this was after October 15th, we would scroll all the way up and I'd say, okay, this is the plan for me next year because this is the lowest cost plan that's going to cover my drugs. Right around here, there would be a green button that says enroll. I will click on that button, and the first thing that the enrollment process would want to know is my Medicare ID number. I would give them the number, fill out some very, very easy questions, name, address, date of birth, just things like that. Answer a few specific questions in reference to specific drugs, and the enrollment would be over probably in less than 5 minutes. So if we wanted to go back and we wanted to look at another drug plan, we could, or we could even compare. If I wanted to compare this recommended plan, which again is always the first plan after we put in the pharmacies, I could click on add to compare. And let's say that my 2022 plan is Anthem MediBlue. Then I could compare these 2 plans just for some basic information. Go down here, click on compare. And here's what they're telling us in the comparison. One of the plans is $10.60. The other plan is $58.20 per month. So that's a big difference in itself. One plan has a deductible, the other plan does not. And these are the total estimated drug and premium costs per year. The reason that WellCare is the recommended plan is because the total cost for premium and drug cost at the pharmacy is $1,226 versus $1,687. So that's a big difference. So if we go back up and we go back, then we're back on the page that's listing all the plans that will cover my drugs. So in reference to terminating your current 2022 plan, you don't need to worry about that because Medicare will automatically terminate your coverage. It's done electronically, so you don't need to make a phone call to your current Part D plan. You will want to notify the pharmacy where you fill your prescriptions so they can update the records with your new plan information the first time you go into the pharmacy in January. So that's important because otherwise, when the charges come up, if you're still using your 2022 plan and it's in January, then you're not going to have anything covered because it'll come up at the pharmacy that you've terminated your coverage. So that's it. I hope you find this tutorial helpful. Feel free to contact me should you have any questions interpreting the results of your drug search, or if you need assistance with enrollment. Thanks very much, and we'll see you next time.